Question 1. Quality control measures reveal a pattern of patient complaints regarding persistent, severe orofacial pain and significant functional limitations, despite initial examinations showing minimal objective findings of peripheral tissue damage or clear neuropathic lesions. A review of these cases indicates that some practitioners are attributing the persistent pain solely to unresolved peripheral inflammation or minor nerve irritation, leading to prolonged and often ineffective localized treatments. What is the most appropriate diagnostic and management strategy for these complex cases, considering the potential for central sensitization? Option A. Focusing exclusively on physical therapy modalities aimed at improving posture and jaw mechanics, assuming the pain is purely musculoskeletal. Option B. Dismissing the patient's reported pain intensity as potentially exaggerated due to the absence of significant objective peripheral pathology, and continuing with conservative localized treatments. Option C. A comprehensive assessment including detailed history, targeted physical examination for peripheral and central sensitization signs, and consideration of psychophysical testing to guide treatment towards addressing both peripheral and central pain mechanisms. Option D. Immediately escalating to high-dose opioid analgesics and aggressive nerve blocks to suppress perceived peripheral nociception. Correct answer is C. A comprehensive assessment including detailed history, targeted physical examination for peripheral and central sensitization signs, and consideration of psychophysical testing to guide treatment towards addressing both peripheral and central pain mechanisms. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient's reported pain intensity and functional limitation appear disproportionate to objective findings, raising suspicion of a complex interplay between peripheral and central pain mechanisms. The challenge lies in accurately differentiating between nociceptive input, neuropathic sensitization, and central sensitization without relying solely on subjective reports or limited objective data. Misinterpretation can lead to ineffective treatment, patient frustration, and potential escalation of care. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates detailed history, targeted physical examination, and consideration of psychophysical testing to evaluate for signs of central sensitization. This aligns with the DAAOP emphasis on understanding the multifaceted nature of orofacial pain, which often involves more than just peripheral tissue damage. By considering central mechanisms like hyperalgesia and allodynia, a clinician can develop a more accurate diagnosis and a tailored treatment plan that addresses both peripheral and central components, leading to better patient outcomes and adherence to best practices in pain management. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's reported pain solely based on the absence of clear peripheral pathology. This fails to acknowledge the well-established role of central sensitization in chronic pain conditions, a critical area of DAAOP competency. Ethically, this approach neglects the patient's subjective experience and can lead to a breakdown in the therapeutic relationship. Another incorrect approach would be to immediately escalate to aggressive pharmacological interventions without a thorough understanding of the underlying pain mechanisms. This can be driven by a desire for rapid symptom relief, but overlooks the potential for central sensitization to be exacerbated by certain medications or to require non-pharmacological management. This approach may also violate principles of judicious prescribing and patient safety. A third incorrect approach would be to focus exclusively on peripheral treatments, such as local injections or physical therapy targeting specific tissues, without assessing for central sensitization. While these treatments may be beneficial for peripheral nociception, they are unlikely to be effective if central sensitization is the primary driver of the patient's ongoing pain and functional impairment. This represents a failure to apply a holistic and mechanism-based approach to pain management, which is central to advanced orofacial pain practice. Professional reasoning. Professionals should approach such cases by first conducting a thorough history, paying close attention to pain descriptors, duration, exacerbating and alleviating factors, and functional impact. This should be followed by a targeted physical examination to identify any peripheral nociceptive or neuropathic signs. Crucially, the assessment must then extend to evaluating for evidence of central sensitization, such as widespread pain, allodynia, hyperalgesia, and altered sensory processing. This systematic, multi-layered approach allows for a more precise diagnosis and the development of an evidence-based, patient-centered treatment plan that addresses the full spectrum of pain mechanisms. Question 2. Quality control measures reveal a patient presenting with persistent, unilateral facial pain characterized by sharp, electric shock-like sensations interspersed with a constant burning ache. The pain is exacerbated by light touch to the affected area and is associated with some autonomic symptoms. Based on the suspected involvement of specific pain pathways, which of the following diagnostic and therapeutic considerations best reflects an optimized approach for this patient? Option A. Prioritize a detailed neurological examination to assess for cranial nerve deficits and consider diagnostic blocks targeting specific branches of the trigeminal nerve to differentiate between nociceptive and neuropathic components of the pain, guiding the selection of pharmacotherapy and interventional strategies. Option B. Prescribe a muscle relaxant and recommend heat therapy, assuming the pain is primarily muscular in origin, and defer any further diagnostic workup until these initial treatments have been attempted. Option C. Administer a broad-spectrum opioid analgesic to manage the severe pain and recommend a course of non-steroidal anti-inflammatory drugs, NSAID, to address any underlying inflammatory processes without further detailed pathway investigation. Option D. Focus solely on psychological interventions and reassurance, assuming the pain is primarily psychogenic in origin due to the subjective nature of the reported symptoms, and avoid any physical or pharmacological interventions. The correct answer is A. Prioritize a detailed neurological examination to assess for cranial nerve deficits and consider diagnostic blocks targeting specific branches of the trigeminal nerve to differentiate between nociceptive and neuropathic components of the pain, guiding the selection of pharmacotherapy and interventional strategies. Explanation. Scenario analysis. This scenario presents a challenge in accurately diagnosing and managing orofacial pain, specifically when a patient's reported symptoms suggest a complex interplay of nociceptive and neuropathic mechanisms. The difficulty lies in differentiating the primary source of pain and ensuring that treatment targets the correct pain pathway. Misinterpretation can lead to ineffective treatment, patient frustration, and potential escalation of pain or development of chronic pain syndromes, all of which have significant implications for patient well-being and the practitioner's professional standing. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's pain, considering the known neuroanatomy and physiology of afferent and efferent pain pathways. This includes a thorough history, detailed physical examination, and potentially diagnostic testing to identify the specific neural structures involved and the type of pain signaling, e.g., nociceptive, neuropathic, nociplastic. By focusing on the underlying pain mechanisms and their pathways, the practitioner can select evidence-based treatments that are most likely to provide relief and address the root cause, aligning with the DAAOP commitment to advanced, evidence-based orofacial pain management. This approach is ethically sound as it prioritizes patient welfare through accurate diagnosis and effective treatment, adhering to the principles of beneficence and non-maleficence. Incorrect approach is analysis. One incorrect approach would be to solely rely on a single diagnostic modality or a generalized treatment protocol without a nuanced understanding of the specific pain pathways involved. This fails to acknowledge the complexity of orofacial pain and can lead to misdiagnosis and inappropriate treatment, potentially causing harm or delaying effective care. Ethically, this represents a failure in due diligence and a deviation from the standard of care expected of a diplomate. Another incorrect approach would be to dismiss or minimize the patient's subjective pain report in favor of objective findings alone, without considering how central sensitization or other central processing alterations might be influencing the perceived pain intensity and quality. This disregards the patient's experience, which is a critical component of pain assessment and can lead to a breakdown in the therapeutic relationship. It also fails to address the full spectrum of pain mechanisms, including those involving efferent pathways that modulate pain perception. A third incorrect approach would be to prescribe broad-spectrum analgesics or interventions without a clear understanding of whether the pain is primarily driven by peripheral nociception, nerve injury, or central sensitization. This can lead to polypharmacy, potential side effects, and a lack of targeted relief, ultimately failing to meet the patient's needs and potentially exacerbating their condition. This is ethically problematic as it does not represent the most effective or least harmful course of action. Professional reasoning. Professionals should approach such cases by first establishing a comprehensive differential diagnosis based on the patient's history and physical examination. This involves actively listening to the patient's description of pain, its characteristics, triggers, and relieving factors, and correlating these with anatomical knowledge of the trigeminal nerve and its associated pathways. Next, they should consider the potential involvement of different pain mechanisms, nociceptive, neuropathic, nociplastic, and how these manifest through afferent and efferent signaling. Treatment planning should then be guided by this mechanistic understanding, prioritizing interventions that are evidence-based for the identified pain pathway. Regular reassessment of treatment efficacy and patient response is crucial, with adjustments made as needed. This iterative process ensures that care remains patient-centered, evidence-based, and ethically sound, reflecting the high standards of the DAAOP. Question 3. Assessment of a patient presenting with unilateral facial pain, described as a burning sensation that has been present for 3 months, with intermittent sharp, electric shock-like exacerbations, and a history of dental work in the affected area, requires a comprehensive risk assessment. Which of the following approaches best facilitates this risk assessment within the DAAOP framework? Option A. Asking the patient to rate their pain on a numerical scale, and inquiring about their previous experiences with pain relief medications to determine the most effective analgesic. Option B. Systematically inquiring about the onset, duration, character, aggravating and alleviating factors of the pain, and specifically screening for red flag symptoms such as neurological deficits, fever, or unexplained weight loss, in addition to exploring the dental history. Option C. Prioritizing questions about the intensity and frequency of the burning pain and the duration of the sharp exacerbations to guide immediate pain management strategies. Option D. Focusing primarily on the patient's dental history and the details of recent dental procedures to identify a potential odontogenic source for the pain. The correct answer is C. Prioritizing questions about the intensity and frequency of the burning pain and the duration of the sharp exacerbations to guide immediate pain management strategies. Explanation. Scenario analysis. This scenario is professionally challenging because the patient presents with a complex array of symptoms that could stem from various orofacial pain etiologies, including temporomandibular joint disorders, neuropathic pain, or even referred pain from other sources. The risk assessment is crucial to differentiate between potentially serious underlying conditions requiring urgent medical intervention and more common orofacial pain presentations. A failure to adequately assess risk can lead to delayed diagnosis, inappropriate treatment, and potential harm to the patient. The DAAOP framework emphasizes a thorough, systematic approach to patient history to ensure comprehensive risk stratification. Correct approach analysis. The correct approach involves systematically gathering information about the onset, duration, character, aggravating and alleviating factors, and associated symptoms of the patient's pain. Crucially, it includes screening for red flag symptoms such as neurological deficits, unexplained weight loss, fever, or a history of malignancy, which would necessitate further investigation or referral. This aligns with the DAAOP commitment to evidence-based practice and patient safety, ensuring that all potential serious conditions are considered and appropriately managed according to established clinical guidelines and ethical responsibilities to provide competent care. Incorrect approaches analysis. One incorrect approach would be to immediately focus solely on the most common orofacial pain conditions, without a comprehensive risk assessment. This overlooks the possibility of serious underlying pathology, violating the ethical duty to rule out more significant diagnoses and potentially delaying critical treatment, which is a failure of due diligence and patient advocacy. Another incorrect approach would be to rely heavily on patient self-diagnosis or anecdotal evidence without a structured clinical inquiry. This bypasses the professional responsibility to gather objective and subjective data through a systematic history, potentially leading to misdiagnosis and ineffective or harmful treatment, and failing to adhere to professional standards of care. A third incorrect approach would be to prioritize treatment modalities before a thorough understanding of the patient's history and risk factors. This demonstrates a lack of systematic evaluation and can result in inappropriate interventions that do not address the root cause of the pain or may even exacerbate the condition, representing a departure from evidence-based and patient-centered care. Professional reasoning. Professionals should employ a structured, patient-centered approach to history taking. This involves active listening, open-ended questioning, and the systematic exploration of the chief complaint, followed by a detailed review of systems and relevant medical history. A critical component is the proactive identification and evaluation of risk factors and red flags to guide further diagnostic steps and ensure patient safety. This systematic process allows for accurate diagnosis, appropriate management, and adherence to professional and ethical obligations. Question 4. Comparative studies suggest that while myofascial pain syndrome, MPS, is a common cause of orofacial pain, its diagnosis and management can be complex. A 45-year-old patient presents with unilateral, dull, aching pain in the masseter and temporalis muscles, exacerbated by chewing and clenching. The pain is described as radiating to the temple and ear. Palpation reveals tender, taut bands within the masseter muscle with palpable trigger points that elicit referred pain to the forehead. The patient reports a history of bruxism and significant stress. Considering the DAAOP regulatory framework and guidelines for the diagnosis and management of orofacial pain conditions, which of the following approaches best reflects current best professional practice for this patient? Option A. Conduct a comprehensive orofacial pain evaluation including a detailed history, physical examination focusing on palpation of trigger points and assessment of referred pain patterns, and consider diagnostic imaging if other pathologies are suspected. Option B. Prescribe a high-dose opioid analgesic to manage the acute pain and schedule a follow-up appointment in 1 month. Option C. Initiate a trial of muscle relaxants, an NSAID, and advise the patient to wear a hard occlusal splint at night. Option D. Refer the patient immediately to a neurologist for evaluation of a potential neuropathic pain disorder. The correct answer is C. Initiate a trial of muscle relaxants and NSAID, and advise the patient to wear a hard occlusal splint at night. Explanation. This scenario presents a professional challenge due to the inherent complexity of diagnosing and managing myofascial pain syndrome, MPS, within the established scope of practice for orofacial pain specialists. The challenge lies in differentiating MPS from other orofacial pain conditions, which are often present with overlapping symptoms, and in developing a treatment plan that is both evidence-based and compliant with the DAAOP regulatory framework, which emphasizes a comprehensive, patient-centered approach grounded in scientific literature and ethical practice. Careful judgment is required to avoid over-reliance on single diagnostic modalities or treatments, and to ensure that patient care aligns with the highest standards of professional conduct. The correct approach represents best professional practice because it integrates a thorough patient history, a detailed physical examination focusing on trigger points and referred pain patterns characteristic of MPS, and the judicious use of diagnostic imaging only when indicated to rule out other pathologies. This approach is ethically sound and professionally responsible as it prioritizes a differential diagnosis, patient safety, and the development of a multimodal treatment plan that may include pharmacologic management, physical therapy, and patient education, all within the established scope of practice for orofacial pain specialists. This aligns with the DAAOP commitment to evidence-based practice and the delivery of high-quality patient care. An incorrect approach that relies solely on pharmacologic intervention without a comprehensive assessment fails to address the multifactorial nature of MPS and may lead to suboptimal outcomes or the masking of underlying issues. This is a regulatory and ethical failure, as it deviates from the principle of providing holistic care and may violate guidelines that advocate for a multimodal approach to chronic pain management. Another incorrect approach that involves aggressive manual therapy techniques without adequate assessment of contraindications or patient tolerance risks iatrogenic injury and is ethically questionable. This failure stems from a lack of due diligence in patient assessment and a disregard for the principle of do no harm. Furthermore, an approach that dismisses the patient's subjective experience focuses exclusively on a single symptom without considering the broader orofacial pain complex is professionally deficient. This can lead to misdiagnosis and inappropriate treatment, violating the ethical obligation to provide competent and compassionate care. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's chief complaint, a comprehensive review of their medical and dental history, and a thorough physical examination. This should be followed by the formulation of a differential diagnosis, the selection of appropriate diagnostic tests, if any, and the development of a personalized, evidence-based treatment plan. Regular reassessment of the patient's response to treatment and adjustment of the plan as needed are crucial components of ongoing professional care. Adherence to the DAAOP standards and guidelines ensures that all diagnostic and therapeutic interventions are within the scope of practice and ethically sound. Question 5. Stakeholder feedback indicates a need for improved diagnostic reasoning in complex orofacial pain cases. A patient presents with unilateral, sharp, electric shock-like facial pain, exacerbated by light touch and cold stimuli, with intermittent periods of complete remission. The pain is localized to the infraorbital region. The patient denies any history of trauma, dental infection, or sinus pathology. Which of the following diagnostic approaches is most appropriate for initiating the differential diagnosis process in this scenario, adhering to DAAOP standards? Option A. Focus solely on ruling out dental causes of pain through extensive radiographic imaging of all teeth in the affected quadrant. Option B. Prescribe broad-spectrum antibiotics to address potential underlying inflammatory or infectious processes contributing to the pain. Option C. Immediately initiate empirical treatment for trigeminal neuralgia based on the characteristic pain description. Option D. Conduct a comprehensive history and physical examination, including neurological assessment and palpation of relevant structures, to systematically narrow down the differential diagnosis. Correct answer is C. Immediately initiate empirical treatment for trigeminal neuralgia based on the characteristic pain description. Explanation. This scenario presents a professionally challenging situation due to the complexity of orofacial pain, which often involves overlapping symptoms and multiple potential etiologies. The challenge lies in accurately differentiating between conditions that may present with similar subjective complaints, requiring a thorough and systematic diagnostic process. The DAAOP certification emphasizes a high level of expertise in this area, necessitating a diagnostic approach that is both comprehensive and evidence-based, adhering to established clinical guidelines and ethical standards for patient care within the United States regulatory framework. The correct approach represents best professional practice because it prioritizes a systematic, multifaceted diagnostic strategy. This includes a detailed history, comprehensive physical examination, and judicious use of diagnostic aids, all aimed at identifying the underlying cause of the orofacial pain. This aligns with the DAAOP commitment to evidence-based practice and patient safety, ensuring that treatment is targeted and effective. Adherence to the American Dental Association's ADA Principles of Ethics and Professional Conduct, as well as state dental board regulations governing the practice of dentistry and pain management, is paramount. This approach minimizes the risk of misdiagnosis and inappropriate treatment, which could lead to patient harm and professional liability. An incorrect approach that relies solely on a single diagnostic modality or symptom without considering the broader differential diagnosis is professionally unacceptable. This could violate ethical principles by failing to provide adequate care and potentially leading to delayed or incorrect treatment, which is a breach of the duty of care owed to the patient. Furthermore, such an approach may not meet the standards of practice expected of a diplomate of the American Board of Orofacial Pain, potentially leading to disciplinary action by state dental boards or professional organizations. Another incorrect approach might involve premature treatment initiation based on a presumptive diagnosis without sufficient supporting evidence. This is ethically problematic as it bypasses the necessary due diligence in diagnosis, potentially exposing the patient to unnecessary risks and costs associated with ineffective or harmful treatments. This also fails to uphold the professional obligation to practice within the scope of one's expertise and to ensure that diagnostic and therapeutic decisions are well-founded. The professional decision-making process for similar situations should involve a structured approach. 1. Elicit a comprehensive patient history, including pain characteristics, aggravating/alleviating factors, associated symptoms, and relevant medical/dental history. 2. Conduct a thorough physical examination, including palpation, range of motion assessment, neurological screening, and examination of relevant structures. 3. Formulate a differential diagnosis, listing all plausible conditions that could explain the patient's symptoms. 4. Select appropriate diagnostic tests or imaging studies to help confirm or refute specific diagnoses within the differential. 5. Integrate all findings to arrive at a definitive or working diagnosis. 6. Develop a treatment plan based on the diagnosis, which may involve further diagnostic steps or direct therapeutic intervention. 7. continuously reassess the patient's response to treatment, and refine the diagnosis and plan as needed. This systematic process ensures that all relevant factors are considered, leading to the most accurate diagnosis and effective patient management, in accordance with U.S. regulatory and ethical standards. Question 6. To address the challenge of accurately defining and classifying orofacial pain for effective patient management, which of the following approaches best aligns with the diagnostic and classification principles recognized by the American Board of Orofacial Pain, ABOP? Option A. Categorizing orofacial pain primarily by the patient's subjective description of the sensation, such as sharp, dull, or burning, without further mechanistic investigation. Option B. Relying on a general medical classification system for pain that does not specifically address the unique complexities of the orofacial region. Option C. Grouping orofacial pain conditions based on common treatment modalities, irrespective of their distinct pathophysiological pathways. Option D. Classifying orofacial pain based on its presumed underlying mechanism and anatomical origin, utilizing established diagnostic criteria and nomenclature endorsed by the ABOP. The correct answer is D. Classifying orofacial pain based on its presumed underlying mechanism and anatomical origin, utilizing established diagnostic criteria and nomenclature endorsed by the ABOP. Explanation. The scenario presents a professional challenge in accurately defining and classifying orofacial pain, which is critical for effective diagnosis, treatment planning, and communication among healthcare professionals. Misclassification can lead to delayed or inappropriate interventions, impacting patient outcomes and potentially violating professional standards of care. The challenge lies in navigating the nuances of different pain types and their underlying etiologies within the established framework recognized by the American Board of Orofacial Pain, ABOP. The correct approach represents best professional practice because it aligns with the diagnostic and classification systems endorsed by the ABOP, which are designed to standardize the understanding and management of orofacial pain. This adherence ensures that practitioners are using a common language and framework, facilitating interdisciplinary collaboration and evidence-based practice. Specifically, classifying pain based on its origin and mechanism, as recognized by the ABOP, is fundamental to developing targeted treatment strategies. This aligns with the ethical imperative to provide competent and appropriate care. An incorrect approach that relies solely on symptom presentation without considering underlying mechanisms fails to meet the diagnostic rigor expected by the ABOP. This can lead to superficial diagnoses and treatments that do not address the root cause of the pain, potentially violating the standard of care. Another incorrect approach that uses outdated or non-standardized classification systems ignores the evolution of the field and the consensus reached by professional bodies like the ABOP, which can be seen as a failure to maintain professional competence and adhere to current best practices. Finally, an approach that prioritizes patient self-diagnosis over professional clinical assessment, while acknowledging patient experience, risks misdiagnosis and inappropriate treatment, which is ethically and professionally unsound. The professional decision-making process for similar situations should involve a thorough patient history, comprehensive clinical examination, and the application of established diagnostic criteria and classification systems. Professionals must continuously update their knowledge of the ABOP-recognized frameworks and guidelines to ensure accurate and effective patient care. When faced with diagnostic uncertainty, consultation with peers or referral to specialists within the field of orofacial pain is a crucial step in ensuring optimal patient management. Question 7. The monitoring system demonstrates a consistent pattern of heightened sympathetic nervous system activity correlating with the patient's reported episodes of sharp, electric shock-like facial pain, which is exacerbated by light touch. Based on the principles of orofacial pain classification, which of the following diagnostic considerations is most strongly supported by this data? Option A. The observed pattern strongly suggests a neuropathic pain etiology, characterized by abnormal signaling within the somatosensory nervous system. Option B. The data primarily indicates a nociceptive pain origin, stemming from actual or threatened damage to non-neural tissue. Option C. The monitoring system's output is insufficient to differentiate between pain types and requires further subjective reporting for any diagnostic conclusion. Option D. The findings are most consistent with a psychogenic pain disorder, where psychological factors are the primary drivers of the pain experience. The correct answer is A. The observed pattern strongly suggests a neuropathic pain etiology characterized by abnormal signaling within the somatosensory nervous system. Explanation: this scenario presents a common clinical challenge in orofacial pain management, differentiating between the primary pain mechanisms to ensure appropriate and effective treatment. The monitoring system's data, while indicative, requires careful interpretation within the established diagnostic framework for orofacial pain, as defined by the American Board of Orofacial Pain, ABOP, and its associated guidelines. The challenge lies in moving beyond symptom presentation to identify the underlying pathophysiology, which dictates the therapeutic strategy. The correct approach involves a comprehensive evaluation that integrates the monitoring system's objective data with the patient's subjective report and a thorough clinical examination. This aligns with best professional practice by adhering to the diagnostic principles emphasized by the ABOP, which prioritize accurate classification of pain types, neuropathic, nociceptive, psychogenic to guide treatment. By systematically considering the characteristics of each pain type and how they manifest in the patient's presentation, the clinician can arrive at a diagnosis that is both evidence-based and patient-centered. This approach ensures that interventions are targeted at the root cause of the pain, maximizing efficacy and minimizing the risk of ineffective or potentially harmful treatments. Incorrect approaches fail to uphold these standards. One such failure would be to solely rely on the monitoring system's output without integrating it with clinical findings. This is a regulatory and ethical failure, because it bypasses the essential clinical judgment and diagnostic process mandated by professional boards like the ABOP. It risks misdiagnosis and inappropriate treatment, potentially leading to patient harm and a breach of the duty of care. Another incorrect approach is to prematurely assign a diagnosis based on a single data point or symptom, without considering the differential diagnoses. This demonstrates a lack of due diligence and a failure to adhere to the systematic diagnostic process required for complex pain conditions. Ethically, this can be seen as a failure to provide competent care. The professional decision-making process for similar situations should involve a structured approach. 1. Gather all available data, including objective monitoring, subjective patient reports, and clinical examination findings. 2. Systematically consider the differential diagnoses based on the primary pain mechanisms, neuropathic, nociceptive, psychogenic, evaluating how each fits the collected data. 3. Formulate a working diagnosis, acknowledging any uncertainties. 4. Develop a treatment plan tailored to the diagnosed pain mechanism, with provisions for reassessment and modification. 5. Document the entire diagnostic and treatment process thoroughly. Question 8. Process analysis reveals a patient diagnosed with a moderate temporomandibular joint disorder, TMD, expresses a strong preference for a specific, experimental splinting device they encountered online, believing it will provide immediate relief, despite the clinician's assessment suggesting a more conservative, multimodal approach including physical therapy and pharmacotherapy would be more appropriate and evidence-based for their condition. The clinician has concerns about the efficacy and potential risks of the experimental device. Option A. Refuse to discuss the experimental splinting device and insist on the conservative treatment plan without further explanation, stating it is the only acceptable option. Option B. Discuss the patient's preference for the experimental splint. Explain the clinician's concerns based on current evidence and clinical guidelines. Present the recommended conservative treatment plan with its rationale, and collaboratively decide on the best course of action, respecting the patient's informed decision. Option C. Immediately prescribe the experimental splinting device as requested by the patient to honor their autonomy and avoid conflict. Option D. Recommend the experimental splinting device without further investigation or discussion of alternative treatments, assuming the patient's online research indicates a valid option. The correct answer is B. Discuss the patient's preference for the experimental splint. Explain the clinician's concerns based on current evidence and clinical guidelines. Present the recommended conservative treatment plan with its rationale, and collaboratively decide on the best course of action, respecting the patient's informed decision. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed desire for a specific treatment and the clinician's professional judgment regarding the most appropriate and evidence-based care for their temporomandibular joint disorder, TMD. The DAAOP framework emphasizes patient-centered care, but this must be balanced with the ethical obligation to provide competent and responsible treatment based on current scientific understanding and clinical guidelines. The challenge lies in navigating the patient's autonomy while upholding professional standards and avoiding potential harm. The correct approach represents best professional practice because it prioritizes a thorough diagnostic process, shared decision-making, and evidence-based treatment planning. This aligns with the DAAOP commitment to advancing orofacial pain management through rigorous scientific principles and ethical conduct. By engaging in open communication, explaining the rationale for alternative or adjunctive therapies, and respecting the patient's ultimate decision-making authority after being fully informed, the clinician upholds both ethical principles and professional responsibilities. This approach fosters trust and ensures that treatment is tailored to the individual's needs and the best available evidence. An incorrect approach that involves immediately acceding to the patient's request for a potentially inappropriate or unproven treatment without adequate assessment or discussion represents a failure to adhere to the DAAOP standards of competence and evidence-based practice. This could lead to patient harm, financial waste, and a breach of the professional duty of care. Another incorrect approach, that of dismissing the patient's concerns or desires outright without attempting to understand their perspective or educate them on alternatives, demonstrates a lack of patient-centeredness and can erode the therapeutic relationship, potentially leading to noncompliance or seeking care elsewhere. Finally, an approach that involves recommending a treatment solely based on anecdotal evidence or personal preference, rather than established scientific literature and clinical guidelines, violates the core principles of responsible orofacial pain management and the DAAOP mandate for evidence-based practice. Professional decision-making in such situations requires a systematic approach. First, a comprehensive assessment to establish an accurate diagnosis and understand the contributing factors to the TMD. Second, a clear and empathetic communication with the patient, actively listening to their concerns and preferences. Third, presenting all viable treatment options, including their risks, benefits, and evidence base, in a manner the patient can understand. Fourth, collaboratively developing a treatment plan that respects the patient's autonomy while ensuring it is clinically sound and ethically justifiable. Finally, ongoing reassessment and adjustment of the treatment plan as needed. Question 9. Market research demonstrates that patients seeking care for orofacial pain conditions often present with varied levels of understanding regarding their pain and its impact. As a diplomate of the American Board of Orofacial Pain DAAOP, which approach to utilizing pain scales and questionnaires best aligns with the DAAOP commitment to evidence-based practice and comprehensive patient assessment. Option A. Primarily relying on a single, widely recognized numerical rating scale, NRS, for pain intensity, supplemented by brief patient interviews to gauge functional limitations. Option B. Employing a combination of validated, multidimensional pain assessment tools that evaluate pain intensity, functional interference, and psychological impact, alongside condition-specific questionnaires where appropriate. Option C. Utilizing subjective patient descriptions of pain and its effects without the formal administration of standardized pain scales or validated questionnaires. Option D. Selecting questionnaires based on their brevity and ease of completion, prioritizing patient comfort and minimizing the time spent on assessment. The correct answer is B. Employing a combination of validated, multidimensional pain assessment tools that evaluate pain intensity, functional interference, and psychological impact, alongside condition-specific questionnaires where appropriate. Explanation. This scenario presents a common challenge in orofacial pain practice, selecting the most appropriate pain assessment tools for a diverse patient population while adhering to professional standards and regulatory expectations. The challenge lies in balancing the need for comprehensive data with patient comfort, accessibility, and the specific diagnostic requirements of orofacial pain. The correct approach emphasizes the use of validated, multidimensional pain assessment tools that are recognized within the field of orofacial pain and align with DAAOP expectations for evidence-based practice. These tools provide a standardized, objective measure of pain intensity, interference with function, and psychological impact, which are crucial for diagnosis, treatment planning, and tracking progress. This approach is best professional practice because it ensures that patient evaluations are thorough, reproducible, and meet the high standards expected of a diplomate of the American Board of Orofacial Pain. It directly supports the DAAOP commitment to evidence-based care and the accurate assessment of complex pain conditions. An incorrect approach would be to rely solely on a single, unidimensional pain scale without considering other crucial aspects of the pain experience. This fails to capture the complexity of orofacial pain, which often involves significant functional and psychological components. Such an approach could lead to incomplete diagnoses and suboptimal treatment plans, potentially violating ethical obligations to provide comprehensive care. Furthermore, it may not meet the implicit expectations of the DAAOP for a thorough and nuanced patient assessment. Another incorrect approach would be to select questionnaires based purely on ease of administration or patient preference, without ensuring their psychometric validity and relevance to orofacial pain conditions. Patient comfort is important. It should not supersede the need for accurate and reliable data. Using unvalidated or inappropriate tools can lead to misinterpretation of findings and hinder effective management, potentially falling short of professional standards and the rigorous evaluation criteria of the DAAOP. Finally, an approach that prioritizes subjective patient reporting without incorporating standardized, validated instruments risks introducing significant bias and inconsistency into the assessment process. While patient self-report is fundamental, it needs to be contextualized and quantified using established methodologies. Relying solely on subjective impressions without objective measures can lead to diagnostic errors and may not align with the data-driven approach expected in specialized fields like orofacial pain. As underscored by the DAAOP emphasis on robust assessment, the professional decision-making process for similar situations should involve a systematic evaluation of available pain assessment tools. This includes considering their psychometric properties, validity, reliability, their relevance to the specific orofacial pain conditions being assessed, their ability to capture multidimensional aspects of pain, intensity, interference, psychological factors, and their practicality for the clinical setting. Consulting current literature and guidelines within the field of orofacial pain and understanding the expectations of certifying bodies like the DAAOP are essential steps in making informed choices that ensure high-quality patient care. Question 10. Consider a scenario where an orofacial pain specialist, newly certified by the DAAOP, is eager to incorporate diagnostic ultrasound into their practice to better assess temporomandibular joint (TMJ) disorders and myofascial pain. The specialist has attended a basic ultrasound workshop and has acquired a portable ultrasound unit. What is the most appropriate next step to ensure the ethical and effective implementation of this technology within the United States regulatory framework? Option A. Rely primarily on the manufacturer's user manual and online forums for ongoing learning and protocol development, assuming that basic workshop training is sufficient for clinical application. Option B. Interpret all ultrasound findings independently and use them to guide treatment decisions without seeking further specialized training or consulting with radiologists or other specialists for complex cases. Option C. Immediately begin using the ultrasound for all new TMJ and myofascial pain patients to gather practical experience and refine techniques based on clinical outcomes. Option D. Pursue advanced, specialized training in musculoskeletal ultrasound with a focus on orofacial applications. Develop evidence-based protocols for its use in diagnosing specific orofacial pain conditions, and consult relevant state and federal guidelines regarding diagnostic imaging and scope of practice for non-radiologists. The correct answer is D. Pursue advanced, specialized training in musculoskeletal ultrasound with a focus on orofacial applications. Develop evidence-based protocols for its use in diagnosing specific orofacial pain conditions, and consult relevant state and federal guidelines regarding diagnostic imaging and scope of practice for non-radiologists. Explanation. Scenario analysis. This scenario presents a professional challenge in the implementation of a new diagnostic modality, ultrasound, within an orofacial pain practice. The challenge lies in integrating this technology effectively and ethically, ensuring it enhances patient care without introducing undue risks or violating professional standards. The DAAOP framework emphasizes evidence-based practice, patient safety, and professional competence. Therefore, any new diagnostic tool must be evaluated against these core principles, considering its utility, the practitioner's proficiency, and the regulatory landscape governing its use in the United States. Correct approach analysis. The correct approach involves a systematic and evidence-based integration of ultrasound. This includes obtaining comprehensive training and demonstrating proficiency in ultrasound techniques, specifically for orofacial pain applications. It also necessitates understanding the current regulatory guidelines and scope of practice for using ultrasound in this context within the United States. This approach aligns with the DAAOP commitment to advanced, evidence-based care and upholds the ethical obligation to provide competent and safe treatment. It ensures that the use of ultrasound is not merely an addition of technology, but a meaningful enhancement of diagnostic capabilities, grounded in validated protocols and professional expertise. Incorrect approaches analysis. One incorrect approach involves immediate widespread adoption of ultrasound for all orofacial pain patients without adequate training or established protocols. This violates the principle of professional competence and patient safety. The DAAOP expects practitioners to be proficient in any diagnostic tool they employ. Without proper training, the interpretation of ultrasound findings can be inaccurate, leading to misdiagnosis, inappropriate treatment, and potential harm to the patient. This also risks violating state or federal regulations that may govern the use of diagnostic imaging equipment and the interpretation of such images by non-radiologists. Another incorrect approach is to rely solely on manufacturer-provided training without seeking independent validation or peer review of the technique's efficacy in orofacial pain. While manufacturer training is a starting point, it may not cover the nuances of orofacial pain diagnosis or be aligned with the highest standards of evidence-based practice expected by the DAAOP. This can lead to a limited understanding of the technology's capabilities and limitations, potentially resulting in suboptimal patient care. A third incorrect approach is to use ultrasound in a manner that exceeds the established scope of practice for orofacial pain specialists in the United States, or to interpret findings without appropriate qualifications. This could involve attempting to diagnose conditions outside the typical purview of orofacial pain, or making definitive diagnoses that are the sole purview of other medical specialties without proper consultation. Such actions could lead to regulatory scrutiny and ethical breaches, undermining the credibility of the profession and potentially jeopardizing patient well-being. Professional reasoning. Professionals should approach the integration of new technologies like ultrasound with a framework that prioritizes patient safety, evidence-based practice, and regulatory compliance. This involves a continuous learning process. First, thoroughly researching the evidence supporting the use of ultrasound in orofacial pain. Second, seeking comprehensive, accredited training and hands-on experience. Third, developing clear, evidence-based protocols for its application. And fourth, staying abreast of evolving regulatory guidelines and scope of practice. Regular self-assessment and peer consultation are crucial to ensure ongoing competence and ethical practice. Question 11. The investigation demonstrates a patient presenting with unilateral, sharp, electric shock-like facial pain exacerbated by light touch to the cheek and jaw. The pain is localized to the distribution of the mandibular and maxillary divisions of a cranial nerve. Based on this presentation and the neuroanatomy of orofacial pain, which of the following diagnostic considerations is most directly supported by the described neuroanatomical localization? Option A. Dysfunction within the trigeminal nerve pathways, specifically affecting the mandibular and maxillary divisions. Option B. A central nervous system disorder affecting the thalamus, which is involved in relaying sensory information but not typically the primary site for such localized peripheral distribution pain. Option C. A primary lesion affecting the glossopharyngeal nerve, which innervates the posterior oral cavity and pharynx. Option D. Involvement of the facial nerve, primarily responsible for motor control of facial muscles and sensation from a small area of the external ear. The correct answer is A. Dysfunction within the trigeminal nerve pathways, specifically affecting the mandibular and maxillary divisions. Explanation. The investigation demonstrates a patient presenting with complex orofacial pain that has not responded to initial conservative management. This scenario is professionally challenging because the differential diagnosis for orofacial pain is broad, encompassing neurological, musculoskeletal, vascular, and psychological etiologies. Accurate diagnosis and effective management hinge on a thorough understanding of the neuroanatomy of the trigeminal nerve and its associated pathways, as well as other cranial nerves involved in orofacial sensation and motor function. The DAAOP certification emphasizes advanced knowledge in this area, requiring diplomates to apply this understanding to clinical decision-making. The correct approach represents best professional practice because it prioritizes a systematic, neuroanatomically informed diagnostic process. This involves correlating the patient's reported pain characteristics, location, quality, intensity, triggers, relieving factors, with specific neural structures and their known functions. For example, understanding the distribution of the trigeminal nerve branches, ophthalmic, maxillary, mandibular, is crucial for localizing pain. Knowledge of the trigeminal nucleus caudalis and its role in processing nociceptive information from the face and oral cavity is essential for understanding central sensitization mechanisms. Furthermore, recognizing the involvement of other cranial nerves, such as the glossopharyngeal or facial nerves, in certain orofacial pain presentations is vital. This approach aligns with the DAAOP mandate to provide expert-level care in orofacial pain, which necessitates a deep understanding of the underlying neurobiological substrates of pain. An incorrect approach that focuses solely on symptomatic relief without a thorough neuroanatomical assessment fails to address the root cause of the pain. This could lead to prolonged suffering, unnecessary treatments, and potential iatrogenic harm. For instance, prescribing broad-spectrum analgesics without identifying the specific neural structures involved might mask underlying pathology or exacerbate central sensitization. Another incorrect approach might involve prematurely attributing the pain to psychological factors without a comprehensive exclusion of organic neurological causes, which is a failure to adhere to the principle of thorough differential diagnosis. This overlooks the primary responsibility of the clinician to investigate and treat the physical basis of pain. A third incorrect approach could be to rely on outdated or incomplete neuroanatomical models, leading to misinterpretations of clinical findings and suboptimal treatment strategies. This demonstrates a failure to maintain current knowledge, a core ethical and professional obligation. The professional decision-making process for similar situations should involve a structured approach. 1. Comprehensive history. Elicit detailed pain history, including onset, duration, character, location, radiation, aggravating and alleviating factors, and associated symptoms. 2. Targeted physical examination. Perform a detailed examination of the orofacial structures, including neurological assessment of cranial nerves, palpation of muscles and joints, and assessment of sensory function. 3. Neuroanatomical correlation. Systematically correlate the patient's reported symptoms and examination findings with specific neural pathways and structures. Consider the potential involvement of the trigeminal nerve and its branches, cranial nerves Roman 9 and Roman 7, and central pain processing pathways. 4. Differential diagnosis. Develop a comprehensive list of potential diagnoses based on the neuroanatomical correlation, prioritizing those that are most likely. 5. Diagnostic investigations. Select appropriate investigations, e.g., imaging, electrodiagnostics, to confirm or rule out suspected diagnoses, guided by the neuroanatomical hypothesis. 6. Treatment planning. Develop a treatment plan that is tailored to the specific diagnosis and addresses the underlying neuroanatomical and pathophysiological mechanisms. 7. Reevaluation and adjustment. Regularly reassess the patient's response to treatment and adjust the plan as necessary, always maintaining a neuroanatomically informed perspective. Question 12. Upon reviewing the case of a patient presenting with unilateral, sharp, electric shock-like facial pain exacerbated by light touch and chewing, which neurological examination approach is most appropriate for initiating a comprehensive diagnostic workup within the DAAOP framework? Option A. A systematic evaluation of all cranial nerves, with specific attention to trigeminal nerve sensory and motor function, palpation of trigger points, and assessment of associated reflexes. Option B. A focus solely on palpating masticatory muscles and assessing jaw range of motion. Option C. A brief assessment of facial sensation and a general cranial nerve screen to rule out gross neurological deficits. Option D. Immediate referral to a neurologist without performing any specific orofacial neurological tests. Correct answer is A. A systematic evaluation of all cranial nerves, with specific attention to trigeminal nerve sensory and motor function, palpation of trigger points, and assessment of associated reflexes. Explanation. This scenario presents a professional challenge due to the potential for misdiagnosis and delayed appropriate treatment, which can significantly impact patient outcomes and satisfaction. The neurological examination in orofacial pain is critical for differentiating between various pain etiologies, including neuropathic pain, musculoskeletal disorders, and referred pain. A thorough and systematic approach is essential to identify the underlying cause and develop an effective management plan. The correct approach represents best professional practice because it prioritizes a comprehensive and systematic neurological assessment tailored to the orofacial region. This aligns with the DAAOP commitment to evidence-based practice and patient-centered care. By systematically evaluating cranial nerve function, sensory pathways, motor control, and reflexes relevant to the face and oral cavity, clinicians can accurately identify neurological deficits that may be contributing to the patient's pain. This methodical process minimizes the risk of overlooking crucial diagnostic clues and ensures that treatment is directed at the root cause, thereby optimizing therapeutic efficacy and patient well-being. Adherence to established diagnostic protocols is implicitly supported by the DAAOP emphasis on rigorous training and competency in orofacial pain management. An incorrect approach that relies solely on subjective patient reporting without a targeted neurological examination fails to meet professional standards. This omission can lead to a superficial understanding of the pain mechanism, potentially resulting in misdiagnosis and inappropriate treatment. Ethically, this constitutes a failure to provide a complete and competent assessment, potentially violating the principle of beneficence by not acting in the patient's best interest. Furthermore, it may contraindicate the DAAOP expectation of advanced diagnostic skills. Another incorrect approach that focuses only on a limited set of cranial nerves, neglecting other relevant neurological components such as trigeminal nerve branches or associated reflexes, is also professionally deficient. This selective examination risks missing significant neurological involvement, leading to incomplete diagnosis and suboptimal treatment. It demonstrates a lack of comprehensive understanding of orofacial neuroanatomy and neurophysiology, which is a cornerstone of specialized practice in orofacial pain. A third incorrect approach that prematurely initiates aggressive pain management strategies without a thorough neurological workup is ethically problematic. This can lead to unnecessary interventions, potential side effects, and a delay in identifying the true cause of the pain. It disregards the diagnostic imperative and prioritizes symptom management over accurate diagnosis, which is contrary to best practices in specialized pain management and the DAAOP focus on evidence-based diagnosis and treatment. The professional reasoning process for similar situations should involve a systematic approach to differential diagnosis. This begins with a detailed history, followed by a comprehensive physical examination, including a targeted neurological assessment of the orofacial region. Based on these findings, appropriate investigations can be ordered. The clinician must continuously integrate new information to refine the diagnosis and treatment plan, always prioritizing patient safety and evidence-based interventions. This iterative process ensures that the most accurate diagnosis is reached and the most effective treatment is provided. Question 13. The efficiency study reveals that a significant portion of new patient appointments for orofacial pain are exceeding the allocated time, prompting a review of the initial clinical assessment protocols. Considering the DAAOP emphasis on comprehensive diagnostic evaluation, which of the following strategies best balances efficiency with the imperative for thorough patient assessment? Option A. Reducing the duration of the physical examination for patients reporting low pain scores, assuming a simpler etiology. Option B. Delegating the initial pain history taking to administrative staff to save clinician time for the physical examination. Option C. Relying primarily on patient self-reported pain intensity and duration to guide immediate treatment recommendations without a detailed physical assessment. Option D. Implementing a standardized, multimodal screening questionnaire that patients complete prior to their appointment, followed by a focused history and physical examination guided by the questionnaires findings. The correct answer is D. Implementing a standardized, multimodal screening questionnaire that patients complete prior to their appointment, followed by a focused history and physical examination guided by the questionnaires findings. Explanation. The efficiency study reveals a need to streamline the clinical assessment of orofacial pain patients within a practice adhering to the Diplomate of the American Board of Orofacial Pain, DAAOP, standards. This scenario is professionally challenging because it requires balancing the imperative for efficient patient throughput with the DAAOP emphasis on comprehensive and individualized patient care. Overlooking critical assessment components for the sake of speed can lead to misdiagnosis, suboptimal treatment, and potential patient harm, all of which are contrary to professional ethical obligations and the standards expected of a DAAOP diplomate. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and patient-centered assessment that aligns with the DAAOP core principles. This involves utilizing validated screening tools, conducting thorough history-taking, performing a detailed physical examination, and considering psychosocial factors. Such an approach ensures that all relevant diagnostic information is gathered, leading to accurate diagnosis and personalized treatment plans, thereby upholding the highest standards of care and patient safety as mandated by the DAAOP framework. An incorrect approach that solely relies on patient-reported pain intensity without further exploration fails to meet the DAAOP requirement for a comprehensive evaluation. This is a regulatory and ethical failure because it neglects the multifaceted nature of orofacial pain, which often involves complex etiologies beyond simple pain scores. Another incorrect approach that bypasses a detailed physical examination in favor of immediate treatment recommendations is also a significant failure. This violates the principle of first, do no harm, and the DAAOP expectation of a thorough diagnostic process before initiating interventions. Furthermore, an approach that neglects to inquire about the impact of pain on the patient's daily life and emotional well-being represents an ethical lapse, as it fails to address the biopsychosocial model of pain management, a cornerstone of modern orofacial pain practice. Professional decision-making in similar situations should involve a deliberate process of prioritizing patient well-being and diagnostic accuracy. This includes understanding the specific requirements of the DAAOP certification, which emphasizes a deep understanding of orofacial pain mechanisms and their clinical manifestations. Professionals should always begin with a comprehensive history, followed by a targeted physical examination, and then integrate findings with appropriate diagnostic aids. The decision to expedite certain aspects of the assessment should only be made after a preliminary diagnosis is established, and should never compromise the collection of essential data. Continuous professional development and adherence to established clinical guidelines are crucial for maintaining competence and ethical practice. Question 14. Examination of the data shows a patient presenting with persistent, severe orofacial pain that significantly impacts their quality of life. Despite a detailed history and physical examination, objective findings are equivocal, and initial diagnostic imaging has yielded no clear pathological source. The patient expresses frustration and a desire for immediate relief. Which of the following approaches best reflects the current best practice evaluation for this complex presentation within the DAAOP framework? Option A. Initiate a broad differential diagnosis, considering both nociceptive and non-nociceptive pain mechanisms, and explore potential psychosocial contributors, while planning for further targeted investigations and a multimodal treatment strategy. Option B. Focus exclusively on ruling out rare but serious organic pathologies through extensive and potentially invasive diagnostic testing, delaying symptomatic management until a definitive diagnosis is established. Option C. Prescribe a high-dose opioid analgesic to manage the severe pain while awaiting further diagnostic results, prioritizing patient comfort above all else. Option D. Conclude that the pain is likely psychosomatic and recommend immediate referral to a mental health professional without further diagnostic exploration of potential organic etiologies. The correct answer is A. Initiate a broad differential diagnosis, considering both nociceptive and non-nociceptive pain mechanisms, and explore potential psychosocial contributors, while planning for further targeted investigations and a multimodal treatment strategy. Explanation. Scenario analysis. This scenario presents a common challenge in orofacial pain management where a patient's subjective experience of pain, while significant, may not align with objective findings or readily identifiable pathological causes. The challenge lies in balancing the patient's reported distress with the need for evidence-based diagnosis and treatment, while adhering to professional standards of care and ethical obligations. It requires careful consideration of differential diagnoses, the potential for multifactorial pain etiologies, and the patient's psychological and social context, all within the framework of DAAOP standards. Correct approach analysis. The correct approach emphasizes a comprehensive, systematic evaluation that integrates subjective patient reports with objective clinical findings and considers a broad differential diagnosis. This aligns with best practices in orofacial pain, which advocate for a thorough history, detailed physical examination, and appropriate diagnostic investigations. The DAAOP framework implicitly supports this by requiring diplomates to demonstrate mastery of diagnostic principles and treatment planning for complex orofacial pain conditions. This approach prioritizes patient safety and well-being by avoiding premature diagnostic conclusions or interventions, thereby minimizing the risk of misdiagnosis or ineffective treatment. It also upholds ethical principles of beneficence and non-maleficence by ensuring that care is delivered in a manner that is both effective and safe. Incorrect approaches analysis, an approach that immediately attributes the pain to a single, easily identifiable cause without a thorough differential diagnosis, risks overlooking other contributing factors or misdiagnosing the condition. This could lead to inappropriate treatment and a failure to address the root cause, potentially violating the DAAOP standard of competent care. An approach that dismisses the patient's reported pain due to a lack of definitive objective findings is ethically problematic and professionally unsound. It fails to acknowledge the reality of the patient's suffering and can erode the patient-provider relationship, potentially leading to patient abandonment or dissatisfaction. This contravenes the ethical obligation to treat patients with respect and dignity, and to provide care within the scope of practice. An approach that focuses solely on pharmacological interventions without a comprehensive diagnostic workup or consideration of non-pharmacological modalities is a deviation from best practice. It may lead to polypharmacy, adverse drug reactions, and a failure to address the underlying biopsychosocial factors contributing to the pain, which is inconsistent with the holistic approach expected of a diplomate. Professional reasoning. Professionals should approach such cases by first acknowledging the patient's pain as a valid experience. The diagnostic process should be iterative, starting with a broad differential and progressively narrowing it down based on the gathered information. This involves active listening, empathetic communication, and a commitment to a thorough, evidence-based evaluation. When objective findings are limited, the focus should shift to exploring potential functional pain disorders, central sensitization, or other complex etiologies that require a nuanced understanding of neurophysiology and pain mechanisms, consistent with advanced training expected of a DAAOP diplomate. The decision-making process should always prioritize patient safety, efficacy of treatment, and adherence to established professional guidelines and ethical principles. Question 15. Performance analysis shows that a patient presents with unilateral facial pain described as sharp and electric, exacerbated by light touch. The patient reports a history of dental work in the affected area. Considering the DAAOP emphasis on diagnostic accuracy and patient safety in interventional procedures, which of the following represents the most appropriate initial management strategy for this patient? Option A. Prescribe a course of broad-spectrum analgesics and muscle relaxants, deferring any interventional procedures until conservative management has failed. Option B. Recommend immediate referral to a pain management specialist for a nerve block without further evaluation by the orofacial pain specialist. Option C. Initiate a comprehensive diagnostic workup including a detailed history, thorough physical and neurological examination, and consideration of imaging studies to confirm the diagnosis and identify the specific nerve involvement before considering any interventional procedures. Option D. Proceed with a diagnostic nerve block of the suspected affected nerve based on the patient's description of pain and dental history. The correct answer is D. Proceed with a diagnostic nerve block of the suspected affected nerve based on the patient's description of pain and dental history. Explanation. This scenario presents a professional challenge due to the inherent risks associated with interventional procedures, specifically nerve blocks, and the critical need for accurate diagnosis and informed consent within the DAAOP framework. The physician must balance the potential therapeutic benefits of the injection with the possibility of complications, patient dissatisfaction, and adherence to established standards of care. The DAAOP certification implies a commitment to advanced knowledge and ethical practice in orofacial pain management, necessitating a rigorous approach to patient assessment and procedural execution. The correct approach represents best professional practice by prioritizing a comprehensive diagnostic evaluation prior to any interventional procedure. This aligns with DAAOP guidelines that emphasize evidence-based practice and patient-centered care. A thorough history, physical examination, and potentially diagnostic imaging are essential to confirm the suspected diagnosis and identify the specific anatomical target for the nerve block. This systematic approach minimizes the risk of administering an unnecessary or ineffective procedure, thereby protecting the patient from potential harm and unnecessary expense. Furthermore, obtaining informed consent, detailing the procedure, its risks, benefits, and alternatives, is a fundamental ethical and regulatory requirement, ensuring patient autonomy and shared decision-making. An incorrect approach that involves proceeding with a nerve block based solely on a patient's subjective report of pain, without a thorough diagnostic workup, represents a significant regulatory and ethical failure. This bypasses the requirement for a confirmed diagnosis, potentially leading to misdiagnosis and inappropriate treatment. Such an action could be construed as practicing below the standard of care expected of a diplomate of the American Board of Orofacial Pain, potentially violating professional conduct guidelines and exposing the practitioner to liability. Another incorrect approach, such as failing to adequately inform the patient about the risks and alternatives to the nerve block, constitutes a breach of informed consent principles, a cornerstone of medical ethics and patient rights. This failure undermines patient autonomy and can lead to legal repercussions. Administering a nerve block without proper sterile technique or appropriate anatomical landmark identification would also be a critical failure, directly contravening established procedural safety standards and potentially leading to infection or nerve damage, thereby violating the duty of care owed to the patient. Professional decision-making in such situations should follow a structured process. 1. Thoroughly assess the patient's chief complaint and medical history. 2. Conduct a comprehensive physical and neurological examination relevant to orofacial pain. 3. Formulate a differential diagnosis and, if indicated, pursue further diagnostic investigations. 4. Based on a confirmed diagnosis, determine the most appropriate treatment plan, considering conservative measures and interventional procedures. 5. If an interventional procedure like a nerve block is deemed necessary, meticulously explain the procedure, its rationale, potential benefits, risks, and alternatives to the patient, ensuring comprehension and obtaining informed consent. 6. Execute the procedure with meticulous attention to anatomical accuracy, sterile technique, and patient safety. 7. Document all findings, decisions, and procedures comprehensively. Question 16. Market research demonstrates a growing demand for effective pharmacological interventions for chronic orofacial pain conditions, including neuropathic pain and temporomandibular joint disorders. A patient presents with persistent, moderate to severe orofacial pain, accompanied by significant sleep disturbance and a history of anxiety. The patient has previously found limited relief from over-the-counter analgesics. Considering the available pharmacological classes, which approach best reflects current best practices for initiating management in this complex patient profile, adhering to the principles of the American Board of Orofacial Pain. Option A. Prescribe a short course of a potent opioid analgesic to provide rapid pain relief, with instructions for as-needed use to address the patient's immediate suffering. Option B. Immediately refer the patient to a pain management specialist for a nerve block injection, bypassing pharmacological considerations due to the complexity of the presentation. Option C. Initiate treatment with a tricyclic antidepressant known for its efficacy in neuropathic pain and its potential to improve sleep, while closely monitoring for anticholinergic side effects and cardiac effects, and educating the patient on its gradual onset of action. Option D. Recommend a non-steroidal anti-inflammatory drug, NSAID, at the maximum over-the-counter dosage, assuming the pain is primarily inflammatory in nature, and advise the patient to return if symptoms do not significantly improve within 2 weeks. The correct answer is C. Initiate treatment with a tricyclic antidepressant known for its efficacy in neuropathic pain and its potential to improve sleep, while closely monitoring for anticholinergic side effects and cardiac effects, and educating the patient on its gradual onset of action. Explanation. This scenario presents a common implementation challenge in orofacial pain management. balancing evidence-based pharmacological interventions with patient-specific factors and the evolving landscape of treatment guidelines. The challenge lies in selecting the most appropriate analgesic, antidepressant, or anticonvulsant for a patient with chronic orofacial pain, considering potential comorbidities, drug interactions, and the need for long-term management. Careful judgment is required to avoid over-reliance on a single drug class, ensure patient safety, and optimize therapeutic outcomes within the scope of practice defined by the American Board of Orofacial Pain, AAOP. The correct approach represents best professional practice by prioritizing a comprehensive assessment and a stepwise, individualized treatment plan. This aligns with the AAOP emphasis on evidence-based practice and patient-centered care. Specifically, it involves considering the patient's pain phenotype, the presence of comorbid conditions, e.g., anxiety, depression, sleep disturbances, and potential contraindications or interactions with other medications. The selection of a pharmacological agent should be guided by established guidelines for chronic pain management, with a preference for agents with a favorable risk-benefit profile for the specific condition being treated. This approach ensures that treatment is tailored to the individual, maximizing efficacy, while minimizing adverse effects and adhering to ethical principles of beneficence and non-maleficence. An incorrect approach would be to prescribe a broad-spectrum analgesic without a thorough diagnostic workup, assuming a generic pain etiology. This fails to address the underlying mechanisms of the orofacial pain and may lead to ineffective treatment or the masking of more serious conditions. Ethically, this could be considered a failure of due diligence and patient advocacy. Another incorrect approach would be to initiate treatment with a high-potency medication without first exploring less pharmacologically intensive options or non-pharmacological interventions, potentially exposing the patient to unnecessary risks and side effects. This violates the principle of proportionality in treatment. Furthermore, failing to consider the patient's psychiatric history when prescribing antidepressants or anticonvulsants, or neglecting to monitor for potential side effects and drug interactions, represents a significant regulatory and ethical lapse, potentially leading to patient harm and a breach of professional responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive patient assessment. This includes a detailed history of the pain, physical examination, and consideration of psychological and social factors. 2. Differential diagnosis, identifying the specific orofacial pain condition and any contributing factors. 3. Evidence-based treatment selection, reviewing current literature and guidelines for the management of the diagnosed condition. 4. Individualized treatment planning, tailoring the pharmacological regimen to the patient's specific needs, comorbidities, and concurrent medications. 5. Patient education and shared decision-making, ensuring the patient understands the rationale for treatment, potential benefits, risks, and alternatives. 6. Regular monitoring and follow-up, assessing treatment efficacy, monitoring for adverse effects, and adjusting the plan as needed. Question 17. Analysis of a patient presenting with chronic, diffuse orofacial pain, characterized by intermittent sharp, shooting sensations and a constant burning ache, with reported hypersensitivity to light touch in the affected areas. Objective findings on initial examination are largely unremarkable, with no clear signs of infection, trauma, or gross structural abnormalities. The physician suspects a complex interplay of peripheral and central pain mechanisms. Which of the following diagnostic and management approaches best reflects the principles of advanced orofacial pain practice as expected by the Diplomate of the American Board of Orofacial Pain, DAAOP? Option A. Focus solely on identifying a peripheral source of pain through advanced imaging techniques and surgical consultation, assuming the central pain mechanisms are secondary to an underlying peripheral pathology. Option B. Prescribe a broad-spectrum analgesic and anti-inflammatory medication, and advise the patient to avoid stimuli that exacerbate their pain, without further diagnostic investigation into the underlying pain mechanisms. Option C. Conduct a thorough neurological examination, including assessment for allodynia and hyperalgesia, consider diagnostic nerve blocks of suspected peripheral nerves, and initiate a trial of pharmacotherapy targeting both neuropathic and central pain pathways, while also exploring the role of psychological distress and coping mechanisms. Option D. Primarily address the patient's reported psychological distress and anxiety through counseling and relaxation techniques, deferring extensive physical investigations until psychological factors are managed. The correct answer is C. Conduct a thorough neurological examination, including assessment for allodynia and hyperalgesia, consider diagnostic nerve blocks of suspected peripheral nerves, and initiate a trial of pharmacotherapy targeting both neuropathic and central pain pathways, while also exploring the role of psychological distress and coping mechanisms. Explanation: this scenario presents a professional challenge due to the inherent complexity of orofacial pain and the potential for misinterpretation of patient-reported symptoms, especially when objective findings are limited. The physician must balance the patient's subjective experience of pain with the objective diagnostic process, adhering to established diagnostic criteria and ethical principles of patient care. The core of the challenge lies in differentiating between peripheral and central pain mechanisms, as the treatment strategies differ significantly. The correct approach represents best professional practice by prioritizing a comprehensive diagnostic evaluation that systematically explores both peripheral and central mechanisms of pain. This involves a thorough history, physical examination, and potentially diagnostic imaging or nerve conduction studies to identify peripheral nociceptive or neuropathic sources. Simultaneously, it necessitates a careful assessment for central sensitization, including evaluating for allodynia, hyperalgesia, and the impact of psychological factors on pain perception, as per the DAAOP emphasis on a biopsychosocial model. This systematic approach ensures that the diagnosis is evidence-based and that treatment is tailored to the underlying pathophysiology, aligning with the DAAOP commitment to advanced, evidence-based practice in orofacial pain management. An incorrect approach that relies solely on peripheral diagnostic measures without adequately assessing for central sensitization would be professionally unacceptable. This failure could lead to misdiagnosis and ineffective treatment, potentially exacerbating the patient's suffering and undermining trust. Ethically, it violates the principle of beneficence by not pursuing all reasonable avenues to alleviate the patient's pain. Furthermore, it could be seen as a deviation from the DAAOP standards, which advocate for a holistic understanding of pain. Another incorrect approach, focusing exclusively on psychological factors without a thorough investigation of potential peripheral etiologies, is also professionally unsound. While psychological factors are integral to pain management, dismissing potential organic causes prematurely is a diagnostic error. This approach risks overlooking treatable peripheral conditions and could be perceived as invalidating the patient's physical pain experience, leading to patient dissatisfaction and potential ethical complaints regarding inadequate care. Finally, an approach that involves empirical, unguided treatment trials without a clear diagnostic hypothesis based on the pathophysiology of pain is professionally deficient. This haphazard method is inefficient, potentially costly, and can delay accurate diagnosis and effective treatment. It fails to demonstrate a systematic, evidence-based approach to patient care, which is a cornerstone of the DAAOP certification and practice standards. The professional decision-making process for similar situations should involve a structured diagnostic pathway. This begins with a detailed patient history focusing on pain characteristics, onset, duration, aggravating and alleviating factors, and associated symptoms. This is followed by a comprehensive physical examination, including neurological and musculoskeletal assessments relevant to the orofacial region. Based on these findings, a differential diagnosis should be formulated, considering both peripheral and central pain mechanisms. Diagnostic investigations should then be employed judiciously to confirm or refute specific hypotheses. Treatment planning should be integrated with the diagnostic process, addressing the identified pathophysiological drivers of pain. Regular reassessment and adjustment of the treatment plan based on patient response are crucial. Question 18. Quality control measures reveal a recent case where a patient presented with severe, persistent unilateral facial pain, described as sharp and electric, exacerbated by light touch. Objective neurological examination revealed no sensory deficits, motor weakness, or cranial nerve abnormalities. However, the patient reported significant distress and functional impairment. Considering the principles of pain perception and modulation, which of the following diagnostic and management approaches best reflects current best practices for a diplomate of the American Board of Orofacial Pain, DAAOP? Option A. Initiate empirical treatment for neuropathic pain based solely on the patient's subjective description of sharp, electric pain, while acknowledging the absence of objective neurological findings. Option B. Conclude that the pain is likely psychogenic due to the lack of objective neurological deficits, and recommend psychological referral without further diagnostic investigation for orofacial pain etiologies. Option C. Conduct a thorough differential diagnosis for orofacial pain etiologies, including but not limited to trigeminal neuralgia and other neuropathic pain conditions, utilizing a combination of detailed history, specific clinical tests, and potentially advanced imaging or diagnostic blocks, while acknowledging the subjective pain report and its impact on function. Option D. Dismiss the patient's pain report as potentially exaggerated given the absence of objective findings, and advise the patient to manage their pain with over-the-counter analgesics. The correct answer is A. Initiate empirical treatment for neuropathic pain based solely on the patient's subjective description of sharp, electric pain, while acknowledging the absence of objective neurological findings. Explanation: this scenario presents a professional challenge because it requires the clinician to differentiate between a patient's subjective experience of pain and objective findings, while adhering to established diagnostic criteria and treatment guidelines for orofacial pain. The DAAOP certification emphasizes a rigorous, evidence-based approach to diagnosis and management, necessitating a thorough understanding of pain perception and modulation mechanisms within the context of orofacial disorders. The correct approach represents best professional practice by prioritizing a comprehensive diagnostic process that integrates the patient's subjective report with objective clinical assessments and considers the complex interplay of neurobiological, psychological, and social factors influencing pain perception and modulation. This aligns with the DAAOP commitment to evidence-based practice and ethical patient care, ensuring that treatment is tailored to the individual's specific condition and needs, thereby promoting optimal outcomes and patient well-being. Adherence to established diagnostic criteria and treatment protocols, as expected by the DAAOP, is paramount. Incorrect approaches fail to meet professional standards by either over-relying on subjective reporting without adequate objective correlation, or by prematurely dismissing the patient's experience based on limited objective findings. Such approaches risk misdiagnosis, inappropriate treatment, and potential harm to the patient. Ethically, failing to conduct a thorough evaluation and to validate the patient's reported pain constitutes a breach of the duty of care. Regulatory frameworks, including those implicitly guiding DAAOP certification, mandate a systematic and evidence-based approach to patient assessment and management. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's chief complaint, a detailed history of present illness, a comprehensive orofacial examination, and consideration of relevant diagnostic tests. Clinicians must critically analyze the patient's subjective pain report in conjunction with objective findings, employing knowledge of pain perception and modulation to formulate a differential diagnosis. Treatment planning should be guided by evidence-based guidelines and tailored to the individual patient's presentation, with ongoing reassessment of treatment efficacy and patient response. Question 19. The evaluation methodology shows a patient presenting with persistent, unilateral facial pain that is described as burning and stabbing, with no identifiable structural lesion or neurological deficit on initial examination. The pain is not clearly related to mastication or jaw movement, and standard dental and otolaryngological evaluations have been unremarkable. The patient reports significant emotional distress and sleep disturbance secondary to the pain. Considering the diagnostic framework for orofacial pain, which of the following represents the most appropriate next step in the diagnostic and management process? Option A. Recommend immediate referral to a psychiatrist for a primary diagnosis of somatoform disorder, as the pain is not clearly linked to a physical cause and is associated with emotional distress. Option B. Initiate a trial of pharmacotherapy targeting neuropathic pain mechanisms, coupled with a referral for psychological evaluation to address the reported emotional distress and sleep disturbance, while continuing to monitor symptom evolution. Option C. Prescribe a broad-spectrum antibiotic regimen to rule out a subclinical infectious etiology, given the persistent nature of the pain. Option D. Proceed with invasive diagnostic procedures, such as nerve blocks or surgical exploration, to definitively identify a structural cause for the pain, given the lack of objective findings on non-invasive assessments? The correct answer is B. Initiate a trial of pharmacotherapy targeting neuropathic pain mechanisms, coupled with a referral for psychological evaluation to address the reported emotional distress and sleep disturbance, while continuing to monitor symptom evolution. Explanation: this scenario is professionally challenging because atypical facial pain, AF, often presents with complex, subjective symptoms that can be difficult to diagnose definitively, leading to potential diagnostic delays and patient frustration. The absence of clear objective findings on standard physical or imaging examinations necessitates a thorough and systematic approach to differential diagnosis and management, adhering strictly to the established diagnostic criteria and ethical guidelines for orofacial pain practitioners. The correct approach represents best professional practice because it prioritizes a comprehensive, multimodal diagnostic process that aligns with the principles of evidence-based medicine and patient-centered care, as expected within the scope of practice for a diplomate of the American Board of Orofacial Pain, DAAOP. This involves a detailed history, thorough physical examination focusing on neurological and musculoskeletal components, and judicious use of diagnostic tools to rule out other conditions. The emphasis on patient education and collaborative treatment planning is crucial for managing chronic pain conditions like AFP, fostering trust and adherence to therapy. This aligns with the ethical obligation to provide competent and compassionate care. An incorrect approach that relies solely on subjective reporting, without a systematic physical examination, fails to meet the diagnostic rigor required for orofacial pain conditions. It risks misdiagnosis and inappropriate treatment, potentially leading to iatrogenic harm or exacerbation of the patient's condition. This neglects the professional responsibility to conduct a thorough evaluation. Another incorrect approach that prematurely labels the pain as psychological without exhausting all organic etiologies is ethically problematic and professionally unsound. While psychological factors can influence pain perception and management, they should not be considered the primary diagnosis until a comprehensive organic workup has been completed and ruled out. This approach can alienate patients and hinder effective treatment. A further incorrect approach that involves aggressive, unproven interventions without a clear diagnostic rationale or established evidence base is contrary to the principles of safe and effective practice. It exposes the patient to unnecessary risks and financial burdens, violating the duty of care and potentially contravening guidelines for responsible pain management. The professional decision-making process for similar situations should involve a structured diagnostic pathway. 1. Obtain a detailed patient history, including onset, duration, character, location, aggravating and alleviating factors, and impact on function. 2. Perform a comprehensive physical examination, including neurological assessment, palpation of muscles and joints, and assessment of cranial nerves and TMJ function. 3. Consider differential diagnoses, systematically ruling out common and serious conditions. 4. Utilize diagnostic aids judiciously, such as imaging or laboratory tests, only when indicated by the history and physical examination. 5. Develop a collaborative treatment plan based on the most likely diagnosis, incorporating pharmacological, physical therapy, behavioral, and interventional modalities as appropriate, with ongoing reassessment and adjustment. Question 20. Research into the management of chronic orofacial pain necessitates a thorough understanding of patient history. When a patient presents with persistent jaw pain, what approach to history taking best aligns with the DAAOP regulatory framework for comprehensive patient assessment and differential diagnosis? Option A. Immediately focus on the physical characteristics of the pain, such as its location and intensity, and ask about any previous dental treatments. Option B. Primarily explore the patient's emotional state and ask if they have experienced any recent periods of sadness or anxiety, without extensively detailing the pain's physical attributes. Option C. Accept the patient's initial statement about the cause of their pain and proceed directly to discussing potential treatment options they have researched. Option D. Inquire about the temporal relationship between the onset of pain and any recent significant life stressors or changes, and ask the patient about their beliefs regarding the cause of their pain. The correct answer is D. Inquire about the temporal relationship between the onset of pain and any recent significant life stressors or changes, and ask the patient about their beliefs regarding the cause of their pain. Explanation. Scenario analysis. This scenario presents a professional challenge because the patient's reported pain is subjective and potentially influenced by factors beyond purely physical pathology. The clinician must navigate the complexities of patient-reported symptoms, potential somatization, and the need to adhere to established diagnostic and treatment protocols within the DAAOP framework. Accurate and thorough patient history taking is paramount to differentiate orofacial pain etiologies, identify red flags, and establish a foundation for appropriate management, all while respecting patient autonomy and confidentiality. Correct approach analysis. The correct approach emphasizes a systematic and comprehensive exploration of the patient's pain experience, including its onset, character, radiation, associated symptoms, timing, exacerbating and relieving factors, and the patient's perception of its impact. This aligns with the DAAOP emphasis on evidence-based practice and the importance of a detailed differential diagnosis. Specifically, asking about the temporal relationship between the onset of pain and any recent stressors or life events, and inquiring about the patient's understanding of the cause of their pain, are crucial for identifying potential psychosocial contributors or patient-driven beliefs that may influence their presentation and treatment adherence. This detailed history allows for the formulation of a differential diagnosis that considers both organic and psychogenic factors, guiding further diagnostic steps and treatment planning in accordance with DAAOP standards for orofacial pain management. Incorrect approaches analysis, focusing solely on the physical characteristics of the pain without exploring the patient's emotional state or life circumstances, represents a significant regulatory and ethical failure. This approach risks overlooking crucial psychosocial factors that are recognized as significant contributors to chronic pain conditions, potentially leading to an incomplete diagnosis and ineffective treatment. It fails to meet the DAAOP expectation of a holistic patient assessment, prioritizing the patient's self-diagnosis and immediately recommending a specific treatment based on their initial statement without a thorough history is also professionally unacceptable. This bypasses the diagnostic process, potentially leading to inappropriate interventions and failing to address the root cause of the pain. It disregards the clinician's responsibility to conduct a thorough evaluation and could violate ethical principles of beneficence and non-maleficence by exposing the patient to unnecessary or ineffective treatments. Dismissing the patient's reported pain as purely psychological without adequate exploration of physical causes is another critical failure. While psychosocial factors are important, a premature dismissal can alienate the patient, erode trust, and lead to a missed organic diagnosis. This approach is ethically unsound as it does not uphold the principle of thoroughness in diagnosis and can be perceived as judgmental, violating the patient's right to be heard and believed. Professional reasoning. Professionals should approach patient history taking with a structured yet flexible methodology. Begin with open-ended questions to allow the patient to describe their experience in their own words. Then, systematically explore the PQRST, provocation/palliation, quality, region/radiation, severity, timing of the pain. Crucially, integrate questions about psychosocial factors, including stress, mood, sleep, and functional impact, as these are integral to understanding chronic orofacial pain. Always maintain a non-judgmental and empathetic demeanor. If red flags for serious pathology are identified, follow established protocols for further investigation. The goal is to build a comprehensive picture that informs a differential diagnosis and a patient-centered treatment plan, adhering to the ethical and regulatory standards of the DAAOP.